Now we'll look at another classification for humeral fractures. So this classification, I came across this classification when I was reading about Neer. Okay, so Neer is actually a surgeon. I was reading about his biography and I was looking at his contributions to, you know, orthopedics. And I got to see that one of his contributions to orthopedics was that he has actually, you know, given us this type of classification for humeral fractures. Okay, so let me quickly plug my pen. I think the pen is getting low, so it's not, you know, it was not responding well again, but as I plugged it, it's responding well. Okay, so what we have for the near classification is this is the humerus, and this classification is basically for all the type of is for the fractures that could occur, at the humerus. Okay, so what we have here is this. So let me I plug this so the wire. So the Neer classification is actually one of the most widely used methods. So you can categorize what proximal humeral fractures. Okay, so it's based on the number of the fractured parts. Okay, so the A part is considered displacement if it is shifting, and this one is just basically. So let's look at the key points. Okay, key points in the near fracture. So you have the one part displacement. You have the two part displacement. Are you seeing it? You have the three part displacement. You have the four part displacement. So you can pause and observe this very picture, and I'm pretty sure by just by observing this picture you must have done justice to the near classification of the humeral fractures already. Okay, so let's quickly have it. So the one part fractures, we're trying to describe it now. So one part fractures is no segment is significantly displaced. It's very common, all right? One part. See, it's one part like this, but nothing is actually so displaced. You understand? So let me still check out something. Oh, fine. Okay, so I think that's what we got. So for the two part fractures, one segment is displaced. See, okay. So it could be what the surgical neck fractures, the surgical neck. It could be the greater tuberosity. It could be the lesser tuberosity. Okay, okay. It could be surgical neck, greater tuberosity, lesser tuberosity, anatomic neck fractures. Then I have the three part fractures where two segments are displaced, typically involving the surgical neck plus the greater or lesser tuberosity. Greater tuberosity surgical neck, lesser tuberosity and surgical neck. Moving, the four parts, all four segments, that's humeral head, greater tuberosity, lesser tuberosity and shaft, they are all displaced. You can have the varus angulated, the valgus impacted. Okay, so I think that's what we got. There are severe injuries. Okay, of course, the blood vessels that what cause around this place will be distorted too. So there's blood vessel involvement. I have a lot of complications. So relevance. If you have a one part fracture, you can manage it without operations. Everything is intact. Just immobilize, do all those bandage stuff, and two part surgical fixation. Three and four part, you need a lot of surgeries there. Okay. Sometimes some parts are damaged, you have to remove it and actually put prosthesis, repair it. So Neer system is what practical because it links the fracture patterns to treatment decisions. If you now categorize the type of fracture that the patient has, you now know the type of treatment that this patient will need. Okay.